and we are committing to our continued cooperation in its efforts to prevent the spread of the virus in our communities. Through our concerted efforts, we believe that we will soon succeed. We are looking forward to the rollout of our vaccination program here in Quezon City, for which we have already earmarked 1 billion pesos. We are preparing for both the acquisition of the vaccines from the pharmaceutical sector, along with the process in which we can be able to administer these in a timely manner to our citizens through our cold storage facilities and our target of 24 or more vaccination centers. Today, we hope that we can learn more about the strategies that will be employed and recommended by the IATF. We will implement this effectively in the local government and the local level and ensure that we reach our fellow Q citizens whose health we truly value. Maraming salamat po for the initiative and this fellowship today. On behalf of the local government officials and our Q citizens who truly benefit from this meeting, I welcome you all to Quezon City. Let us not forget that we are all called to do one goal and one purpose, and that is to serve God by serving one another, giving all the glory to God and to His name. God bless you po.
Maraming salamat po, Vice Mayor Giancarlo Soto. And for the acknowledgement of our officials and other VIP guests, we would now like to call on Dr. Maria Paz Corrales, CHD of Metro Manila.
Magandang umaga po sa inyong lahat. Bago ko po i-acknowledge ang ating mga bisita, nais ko pong sabihin, konting basa lang po kung bakit nandito po kami. As the country continuously steps up its efforts to transition to a new normal amidst the COVID-19 virus pandemic, the national government, through a whole of the government and the whole of society approach, has been working closely with the local government units, specifically Quezon City today, to ensure vaccine accessibility to each and every Filipino through a quality, effective, safe, and free COVID-19 vaccination program. With the Philippine National Deployment and Vaccination Plan for COVID-19 vaccines on hand, the COVID-19 vaccine cluster headed by no less than Secretary Carlito Galvez, together with the IATF principals, is conducting the vaccine code team visits to the different LGUs here in NCR. We started in Pasig last Tuesday. Yesterday, we were in Taguig in the morning, and in the afternoon, we were in Makati. Today is our fourth LGU, Quezon City. In here, we present the national plans and form coordinative mechanisms with you for the deployment of the vaccines and the implementation of the COVID-19 vaccination program. So that is basically the purpose why we are here. So much of our time will be spent for the presentation of the LGU vaccination plan. So it's my pride and pleasure to acknowledge our friends here. Let me start with yung ina ng Quezon City, Honorable Joy Belmonte. We also have here with us Vice Mayor Gian Soto, Councilor and Chairperson, Committee on Health and Sanitation, Honorable Doriela Soto. We also have the Chief of the Quezon City Health Department, Dr. Esperanza Arias, Mr. Joseph Huico, the Head of the Quezon City Investment Affairs Office and Chair Task Force Vaccine, and of course, my companion here a while ago, Ms. Teresa Terona, the Head of the City Tourism Affairs Department. Joining us as a hospital representative is Dr. Josephine Sabando, Quezon City General Hospital. Now, on the national level, we have CABSEC, Carlo Nograles, co-chair, IATF. And of course, who cannot recognize the one and only Secretary Carlito Galvez, the vaccine czar. And in a while, Secretary Duque will be joining us. He just has an important appointment and is about to be here. We also have ASEC Marcelo Morales of the ILG, ASEC Elmer Punsalan of DOH, and Director Aleli and Grace Sudyakal to represent the Disease Prevention and Control Bureau of DOH. Our partners from the private sector, representatives from St. Luke's Medical Center, Quezon City. She's a friend of mine, Dr. Ona, and Dr. Domingo. And of course, Ms. Janet Jacusalem, the Chief Business Officer of Swillig Pharma Corporation. We also have some members from the DOH NCR. You have the DOREP here, Sally Espeleta, and Dr. Yen de la Cruz. So I guess I have already, did I miss anybody? Okay, thank you very much, and I hope we have a pleasant and fruitful, productive day ahead of us.
Mic test. Okay. That's okay, Doc. We cannot share microphones. We're very strict here. Okay, because the IATF is here, so I really have to show you that CT is complying, ma'am. Okay, for our first message to be delivered by one of the high officials of the IATF committee, let us all welcome the NTF Against COVID-19 Chief Implementer and Vaccine Czar. I've met him also in Davao several years ago. Secretary, may I call on Secretary Carlito Galvez Jr.
Thank you, Madam, for your kind introduction. First of all, I would like to greet our mayor, the undefatigable mayor, talaga napakabait, and he is one of the judges recently, one of the most performing mayor in the NCR, not only in the NCR but also in the different in our country. Madam Honorable Joy Belmonte, ma'am. And also we have our friend from the cabinet. He is some sort of siya yung bastonero namin sa cabinet. And he's the one really helping us also in the peace process. Cabinet Secretary Carlo Alexi Nograles. Siya po ang co-chair din po ng IATF. May I also greet our Vice Mayor Quezon City, Honorable Gian Soto. Paki-regards kay Daddy. Then also Honorable Doriela Soto, Councilor and Chairperson at the Committee on Health and Sanitation. Dr. Esperanza Arias, the Chief Quezon City Health Department. Mr. Joseph Wico, Head Quezon City in Investment Affairs, Office of the Chair and Task Force Vaccine. Ms. Teresa Tirona, Head City Tourism Affairs Department. Dr. Josephine Sabando, Quezon City General Hospital. We have also from the IATF and NTF officials, we have ASEC Marcelo Morales from the ILG, ASEC Elmer Punsalan from DOH, Dr. Maria Paz Picurales, ito talagang halos araw-araw, gabi-gabi, nagpupuyat, Regional Director, Centers for Health Development, Metro Manila. Director Aleli Annie Grace Sudyakal, Disease Prevention and Control Bureau, DOH. Then our partners, Ms. Janet Jacusalem, the Chief Business Officer, Swillig Pharma, and also the representative from St. Luke Medical Center, Quezon City, Dr. Ona and Dr. Domingo. Magandang umaga po sa inyo lahat. First of all, Madam, maraming salamat. Pasensya na po at noong last Friday po, hindi po ako ano po talaga dahil kasi because of some important hearings. But first of all, I would like to thank you, Madam, and congratulations for all the things that you have done for Quezon City. Alam natin na Quezon City, yung matagal ko nang sinasabi, talagang it is a very challenging job to become a mayor ng Quezon City because in terms of population, you are among the biggest na sa lahat dito sa bansa. At nakikita natin na halos pati yung Bulacan and other underlying areas, Rizal, sa inyo pa rin pupunta because most of the hospitals, more than 11 hospitals, ay nahandito po sa Quezon City. At kayo po, Mayor, since noong March, talagang nakita ko po talaga yung dedikasyon nyo, yung paghihirap nyo talaga na nakikita namin na talagang hindi po kayo natutulog. At minsan nagte-text po tayo mga 12 o'clock na po ng gabi. Madam, congratulations and thank you very much. First of all, we'd like to convey our gratitude to the local government of Quezon City, led by Mayor Joy Belmonte, for the unwavering support and cooperations you have given to the national government in our fight against this pandemic since it started a few months ago. It is worth noting that Quezon City is among the many LGUs who have signed the tripartite agreements with the national government and AstraZeneca to purchase COVID-19 vaccines. Under the agreement, the Quezon City government increased its initial order from 750,000 doses to 1.1 million doses, which will be able to inoculate more than 500 to 600 people. This development is expected to provide a major boost to our national immunization program. Thank you very much. Palakpakan po natin si Mayor. As I have said earlier, Quezon City is the biggest city in the country in terms of its population. At nakita rin po natin na lahat po na nakakasakit dito rin po pumupunta sa Quezon City. And talaga si Mayor, talagang pagka nag-inaugurate kami ng mga hospital sa East Avenue, talagang nakikita namin talaga yung energy niya. Talagang we're very excited na makapunta po dito, Mayor. This is the reason why we appreciated very much the measures being carried out by the city under the leadership of Mayor Joy to help the national government in securing a safe, effective, and sufficient vaccines for all city constituents and for all Filipinos. Sang-ayon po kami kay Mayor Joy na kapag mas maraming residente sa Quezon City ang mababakunahan, mas mapapabilis ang ating pagkamit ng herd immunity sa buong bansa. The tripartite agreements we have signed with LGUs and the private sector is a concrete indication that our call for whole-of-nation, whole-of-society approach in fighting this pandemic is bearing much fruit. Moreover, they are testament of the Filipino people bayanihan spirit. Sabi nga po ng Pangulong Rodrigo Roa Duterte, kapag nagkakaisa at nagtutulungan tayong lahat, ay tuluyan na nating masusugpo ang pandemya na ito at mas mapabilis ang pagbangon ng ating ekonomiya. We must keep in mind, however, that effective planning and preparation are key factors in the success of this massive and historic inoculation program. Kaya naman, labis na kinakatuwa ng CODE team ang paghahandang ginagawa ng maraming lungsod, lalo na ang Quezon City, sa buong bansa na nalalapit na pagdating ng mga bakuna. The LGUs are the national government's grassroots implementers. The mobilization of people on the ground, as well as the execution of the immunization program, will largely depend on our readiness to help to carry out this program. We are therefore pleased to know that Quezon City government plans to increase by 2 to 3 times the current number of its health workers who will be administering the vaccine, and at the same time, the city is now expanding the list of its vaccine sites. At nabasa ko rin po sa ating periodiko na ang ating mahal na mayor ay he is also engaging with the religious sector. At napakalaking po yun, napakalaking advantage po yun dahil kasi alam po natin napaka-influensya ng ating mga religious and it will give more confidence to our people to take the vaccine. At the same time, marami pong mga volunteer ang ating mga religious component. And also, I know that you are also expanding with the private sector. At natutuwa po ako na talagang pati po yung ating economic frontliners ay binibigyan niyo po ng tuon ng pansin kahit na hindi taga Quezon City. Kasi alam niyo po na parang pamilya na rin po yung mga institution po dito na lahat ng mga tinatawag nating economic drivers ay napaka-importante po sa Quezon City. At parang nangyayari po, itong mga ating mga trabahante ay parang inaanak nyo na rin po dahil kasi nakita natin na malaki rin po ang nagiging tulong po nila. At narinig ko po na talagang you are more than willing to give the other doses to your neighboring municipalities. To ensure the efficient rollout of our vaccine program, it is crucial for our LGUs to come up with the three lists. The list of your target vaccine recipients, the list of personnel who will be deployed as vaccinators, and the list of vaccination centers. Alam namin talagang prepare ng Quezon City at napakahalaga po ng listahang mga ito na maayos at mabilis sa pagsasagawa ng ating immunization program. At higit sa lahat, upang maiwasan ang pagkasayang ng bakuna sa panahon ng madala na ito sa komunidad, kailangan po talaga na magkaroon tayo ng tinatawag na agreement with the cold chain operator. At nakita namin na dito ang Swilig Pharma na at least nagtumutulong po sa atin na at least we can have an end-to-end planning of our vaccination program. Napakaganda po dahil kasi talagang nakikita po natin ang Quezon City, planadong-planado at saka prepare na prepare. Excited na kami rin, Madam, na makita po na mag-succeed po ang inyong pagbabakuna. We would like also to emphasize that the local government units also play an important role in explaining to the residents our national vaccination program. Kasi po, ma'am, isa kayo sa mga best influencer dito po sa NCR. Pagka nagsasalita po kayo, marami po ang naniniwala. Kaya po ang LGU, ang ating mga executive mga mayors sa executive branch ng ating sa NCR, nakikita natin po pagka nagsalita po ang mayor, sumusunod po lahat ang mga residente. With the proliferation of verified and fake news, hindi maiwasan na magkaroon sila ng agam-agam at pangamba. Kung kaya't mas kailangan nila ngayon ang tama at wastong impormasyon. There is a need for us to come up with intensified information campaign at the community level so that we can provide greater clarity to the issues and concerns raised by our people. So itong venue po nito, isa po ito sa mga ginagawa po natin na magkaroon po tayo ng tinatawag na positive uptake. As we prepare to the first batch of the vaccine deliveries this February, let us continue to work together to ensure that our people comply with the minimum health protocols, the wearing of face masks and face shields, and maintaining the social distancing and practicing proper hygiene. Kaya po pagka po nagkaroon tayo ng vaccine, kailangan ang formula po natin, vaccine plus. Meaning vaccine plus the observance of the minimum health standard. Ang sinasabi po ng ating mahal na presidente, natutuwa po siya sa lahat ng tulong po ng mga LGUs. Ang sabi niya po, kadalasan, Madam, pagka nag-uusap po kami, yung mga ginagawa ng mga LGUs, darating ang araw, lalo po ang ginagawa ng mga mayors, hindi po kayo makakalimutan ng mga tao. They will always remember your kindness or your compassion. Kami rin po, hindi namin po kayo makakalimutan dahil kasi yung panahon nito ng pandemya, isa kayo sa mga naging haligi para mapuksa na po natin ang pandemic. So sinasabi niya na wala pong maiiwan, hindi po namin kayo iiwanan. And then, ang sinasabi nga po natin lahat sa mga business sector, ingat-angat, bakuna lahat. Dito sa Quezon City, protect todo, sa bakunang sigurado. Maraming salamat po.
Thank you very much, Secretary Galvez. Our next speaker is a representative or co-chairperson of IATF on the management of emerging and infectious diseases. I'd now like to call on Honorable Carlo Alexi Nograles.
Maraming salamat po. Magandang umaga po sa ating lahat. Sa aking kumare, Mayor ng Quezon City, Mayor Joy Belmonte, sa ating butihing Vice Mayor Lian Soto, Councilor Lala Soto, Honorable Wico, Dr. Arias, Ma'am Teresa Tirona, Dr. Rolly Cruz, at sa lahat po ng bubuo ng local government unit, lahat ng officials ng Quezon City. Kami po ni Secretary Charlie Galvez ay lubos na nagpapasalamat. 10 na mga kasama ko dito sa national government, sina Asek Morales at ang buong DILG, ang Department of Health, MMDA, PIA at lahat pa ng officials sa national government ay lubos na nagpapasalamat sa Quezon City government. Unang-una, sa napaka-warm welcome niyo po sa amin. Alam niyo po na isa ako kasama si Secretary Duque na mga big brothers ng Quezon City. Bagamat ako po ay taga Davao City, ay dito naman po ako tumutuloy sa QC gaya ni Secretary Duque. At nung nag-assign po ng mga big brothers sa bawat syudad at lungsod ng Metro Manila ay agad kami nag-volunteer sa QC. Nandito po kami muli para makipag-ugnayan sa Quezon City Government. Pangulang mensahe po namin at darating siguro mamaya-maya si Secretary Duque ay yung aming lubos na pag-congratulate sa QC. Hindi po empty words yung sinabi ni Secretary Charlie Galvez kanina nung sinabi niya congratulations sa inyo, Mayora. Alam ko hindi naging madali itong laban natin against COVID-19. Alam po natin at napag-usapan natin at naunawaan nga po natin kung gaano ka-importante ang Quezon City sa laban dito sa COVID-19. Natandaan ko pa nung nag-usap tayo na napagkasunduan natin na pagdating sa NCR, kung mapababa po natin ang bilang ng COVID-19 infections ng Quezon City, napakalaki po na magiging epekto niyan sa buong NCR. At ngayon po, natutuwa at nagagalak po kami na makita na dito sa Quezon City, sa daily average na mga kaso sa QC, napapaba na po natin ninyo ito ng less than 100 per day. So maraming salamat. Sa isang syudad na kasing lawak, kasing laki, at kasing dami ng population ng QC. Malawak, ngunit sa urban setting, dikit-dikit na bahay, sa bawat purok at bawat barangay ng QC, napaka-challenging po niyan. Kaya alam ko na hindi naging madali itong ginawa po ninyo. At maraming bagamat mga bashers at mga nega dyan, siguro ito yung pinakamagandang example na naipakita ninyo na kahit gaano karaming mga nega at bashers, kailangan isang tabi ang lahat ng yan, just focus on the job at hand at magagawa din natin. Basta sama-sama at tayo'y nagtutulungan. Sa pagbabalik po ng code team ngayong umagang ito, ibang laban na naman po ang ating hinaharap, ang ibang challenge na naman po. At ang challenge po yung pagro-roll out ng ating vaccination program. Ito yung magiging susi natin sa success ng vaccination program tulad ng success natin sa laban against COVID-19. Kung magiging successful din ang rollout ng vaccination program sa Quezon City, maaasahan din po natin ang herd immunity na ating hinahanap para sa buong NCR. Ganun po ka-influential ang QC pagdating sa laban na ito. So nandito po kami para mag-align ng ating mga strategies, makita yung mga best practices ng QC, makita natin ang ano ba ang mga issues at concerns na meron po ang Quezon City para sa ganun, when we roll out the vaccination program here in Quezon City ay planchado na po lahat. That being said, kami po ni Secretary Charlie ay lubos din na papasalamat. We'd like to congratulate Quezon City. Unang-una, dahil po sa inallocate ninyong 1 billion pesos na talaga naman ang QC ang isa sa pinakaunang nagkaroon ng tripartite agreement at kasunduan to secure the vaccines that we need for your city. With that 1 billion pesos na aking halaga, naunawaan po natin that 1 billion pesos, dahil 2 doses nga, would only be able to inoculate around 500 plus thousand residents. For a city as big as QC, kulang pa po yan. Bago tayo nag-umpisa dito sa ating programa, kinausap po kami ni Mayor Joy, ni Councilor Lala, ni Vice Mayor Gian. Sila'y nag-alala. Sa 500,000 na yan, hindi pa natin ma-inoculate ang 70% na hinahanap natin. Dahil sa dami at sa laki ng QC with about 3 million residents, and ma-estimate na natin na ang adult population ninyo dito is about 2.1 million. So, ang agam-agam po ng QC is sa laki ng budget na inallocate and with 500,000 only to be inoculated using that budget, paano yung natitira with 2.1 million na target natin? Kami ni Secretary Charlie at buong IATF at NTF, pati na rin si Pangulong Duterte, have come here today, this morning, to assure the residents of Quezon City, to assure the mayor, the vice mayor, and the city council kung ano po ang kulang, ano po ang kinakailangan na additional vaccines to inoculate the 70% target for Quezon City. Ang national government na po ang bahala dyan. You have our assurance that we will commit to inoculate the 2.1 million to 2.4 million residents of Quezon City that we need to inoculate. We'd also like to commend Quezon City for taking the initiative sa inyong pinakabagong Q-Citizen ID. Naunawaan po natin na itong Quezon City ID na ito ay gagamitin natin para sa pre-registration ng mga magpapabakuna na babakunahan natin. At higit pa po riyan, over and above the Q-Citizen ID, being an ID for the pre-registration and the successful rollout of our vaccination program, naunawaan din po natin that it serves many other purposes. At kasama na po dyan ang pag-access ng e-services portal ng Quezon City at kung ano pa ang magiging haharapin natin mga challenges at hamon pagkatapos po matagumpayan natin itong hamon nito against COVID-19. I think that Q-Citizen ID is very appropriate and talagang kinakailangan sa panahon ngayon dahil maaring hindi ito maging huling pagsubok na ating haharapin together. But with that pre-registration, with the ID, we all look forward to a very successful rollout of the vaccination program in a very clear and organized manner, which is something that we really need, no? And the citizens of Quezon City really need at this time. Sinabi na ni Secretary Charlie Galvez kanina na ang isang challenge na hinaharap po natin at sana po, and I'm very confident that Quezon City will be able to help us in this regard, is yung pag-increase ng ating confidence level sa vaccine. Ang NCR po yung mauuna sa rollout ng vaccination program dahil nandito po yung majority of the cases ng COVID. And because ang NCR ang mauuna sa rollout, kumbaga all the other regions will be looking at NCR. All the other regions will actually be looking at Quezon City. At titingnan at obserbahan nila. At ito nga po ang challenge sa yung mga mauuna. Ang challenge is everybody will be watching kung yan ba ay safe, yan ba ay effective, magkakaroon ba ng adverse effect, ito ba ay maging successful. So with all eyes on us here in the NCR, we look to you, the LGUs, to help us in this regard. Let's build up the confidence level of our citizens. Let's send out the message na tayong lahat, national government, local government, tayong lahat ng mga officials, hindi po tayo papayag na tuturukan ang kapwa nating Pilipino kung hindi natin na-assure ang kaligtasan at ang effectiveness at safety ng mga bakunang ito. And I'm very confident that with you at the helm, Mayor, Vice Mayor, and the City Council, magagawa natin ito. On a personal note, as Chair of Task Force Zero Hunger, I would also like to commend Quezon City for all of your initiatives to feed the people, your initiatives for food security, for urban gardening, for urban farming, and for nutrition and food security for your people in QC. Ito na po ang tanging panlaban natin against the virus, ang kalusugan, ang nutrition ng ating mga kababayan. At siyempre, ang susunod nating haharapin na mga hamon, ang pagbabalik ng trabaho, hanap buhay, kabuhayan ng ating mga kababayan. Yan po ay magagawa natin under the new normal pag siguraduhin natin na maging successful ang vaccination program ng ating pamahalaan. Maraming salamat po, Mayor Joy. Congratulations, and I look forward to working with you as your big brother, as I always have. Maraming salamat for everything that you do and all the sacrifices that you have given to the people of Quezon City. Magandang umaga po muli.
Thank you very much. Thank you very much, sir. Of course, it's Honorable Carlo Nograles for us, co-chairperson of the IATF on the management of emerging and infectious disease. Our next speaker will be from the Department of Interior and Local Government. Let us all welcome Assistant Secretary Marcelo Morales. Welcome, sir.
Maraming salamat po. Ako po ay babati, bagamat nabati na sila kanina, ay muling babati sa ating mga panauhin na kasama ngayon sa ating national government, ang mga cabinet secretaries, Secretary Nograles, sir, Secretary Galvez, sir. And of course, ang ating LGU host ngayong umagang ito, Mayor Joy Belmonte, Vice Mayor Gian Soto, Councilor Lala Soto, at sa lahat ng aking mga kababayan sa Quezon City at sa inyong lahat, isang magandang umaga po. Ang DILG ay patuloy pong naglalabas ng mga memorandums and circulars upang makatulong sa ating mga LGUs na maipatupad ang mga programa ng ating national government. Kasama na po ang pagpapatupad ng ating National Vaccination Program laban sa COVID-19. Ang DILG ay nagpapasalamat kay Mayor Joy, ma'am, dahil ang Quezon City ang isa sa mga naunang naglunsad ng mga programa alinsunod sa mga circulars na ito. At ang Quezon City ay hinigitan pa o nilampasan ang mga standards ng itinakda ng DILG na katulad po ng aking narinig kanina sa aking pakikipagkwentuhan sa local DILG officer na naitap po ang religious sector na makatulong sa pagbabakuna ng inyong mga kababayan dito sa Quezon City. Sa aking palagay, handang-handa na ang Quezon City. Ang bakuna na lamang ang hinihintay. At kung ako ang tatanungin kung saan ako magpapabakuna, ay pipiliin ko dito ako sa Quezon City magpapabakuna. Kung papayag po si Mayor Joy. At ang national government, kasama na po ang DILG, ay laging nakahandang tumulong sa mga taga Quezon City, kay Mayor Joy, upang tapusin po ang laban ninyo sa COVID-19. Maraming salamat. Mabuhay ang taga Quezon City. Mabuhay tayong lahat.
Thank you very much. That's Asek Morales, of course. Okay, I was just given a small notice that Secretary Duque is already on his way up. So we would like to give the last part of the program, for not last part of the messages, and probably we can wait for him. He's already here. Welcome, Secretary Duque. That's okay, sir. Okay, may I just remind everybody that later on, we will be opening the floor for our netizens or our listeners from the virtual. And don't worry, you'll be given a chance to throw in your questions. Live streaming tayo di ba, Bert? So we will, of course, enable that portion of the this virtual forum later on and give them a chance to give you their questions. Secretary Duque, napaka-timing po ng inyong dating kasi kayo na po yung magsasalita. Pagpasensyahan nyo na po kung hindi pa yata kayo nakakaano ng proper but if it's okay with you, may I already call you up here and give us your special message, Secretary Duque. I'm Teta Tirona, sir. Yes, sir. Tirona.
Maraming salamat, Ma'am Teta Tirona. At ako po ay humihingi ng paumanhin. Ako po ay dumating ng huli at nagkaroon po kasi ako ng meeting with the Ambassador of UK to the Philippines at pinag-usapan po yung sa bakuna ng AstraZeneca at napakamahalaga po itong meeting na ito kaya ako po ay kinailangan na makipagkita sa kanya. Ganun pa man ay better late than never, ika nga. At ngayon po sa ngalan ng buong interagency task force na kung saan po kasama ko ang ating vaccine czar na si Secretary Galvez, ang ating pong co-chair person ng interagency task force. Walang iba po kung hindi ang katulad ng ating vaccine czar na napakamasipag. Wala iba kung hindi si Secretary CABSEC Carlo Nograles at ang aking pong mga kasama mula sa Department of Health, ang Assistant Secretary si Dr. Elmer Punzalan at of course ang atin pong ina ng siyudad ng Quezon, walang iba kundi ang magaling, maganda, masipag na Mayor Joy Belmonte of Quezon City, one of the most dynamic local chief executives of the country. And let's give her a big round of applause for leading the great effort, the humongous effort in responding to the pandemic that they are experiencing here in the Quezon City. And also, I'd like to greet the other officials of the city government of Quezon City, and also the joining me from the Regional Center for Health Development of the Department of Health. We have with us Assistant Director Paz Corrales, and she's been around really helping LGUs in the NCR address the gaps in their response to the pandemic COVID-19. Alam ko po na talaga naman na napaka mabigat ng ating hamon hinaharap at sa pagtugon sa pandemyang COVID-19. Pero kami po natutuwa sa IATF kasi po ang sisipag ng mga punong lungsod at kitang-kita po namin yan sa mga ginagawa nila at kami po natutuwa sapagkat napaka-maganda ang pakikipag-ugnayan sa gitna ng mga local chief executives ng NCR at ng IATF at of course the Department of Health. No? At ngayon po, andito kami para suliin maigi kung ano na po ang inyong mga planong nailatag. Pero kampante naman po kami ni Secretary Galvez na inyong po mga plano ay nakalinya. This plan is aligned very well with our national deployment and immunization plan and all the local government units, and in particular in NCR, we have been informed that the various local chief executives have already drawn out their respective local immunization plans, and that is why our periodic visits to the LGUs, not only in NCR but in the rest of the country, and prioritizing, of course, the geographical areas where there is a high attack rate or incidence of COVID-19, high case fatality rate or high mortality rate. And so we are here to assist the local chief executives as to what they feel and objectively see for themselves as gaps in the implementation of this extremely important immunization plan. Remember, insofar as your PDITR is concerned, no? Yung prevention, using the BIDA solution that we cascaded to the various local government units and the BIDA Medisiplina, who is also represented here. And then, of course, we have the Ingat Buhay para sa Hanap Buhay. And then we have, of course, the seven commandments of the DOTR, the Apat Dapat of the Health Professionals Alliance Against COVID-19, as well as the 3 V's and the 3 C's of the various experts groups, no, that have been so generous in really helping give clarity to our messaging for the public, so that they have a better understanding of how they can contribute to the response. Because at the end of the day, this is not just the work of government alone, not of the national, not of the local alone, but this is really work not even of just the private sector. So this is really a coordination, a collaboration, a cooperation, a complementation of both the public and the private sectors. No? And so the success of our pandemic response relies heavily on that complementarity of the public and private sector capacities. No? We need to mine the different sectors' capacities, and we should always welcome their offer to contribute to a much higher rate of success in our pandemic response. And that is why we are here and appreciate Mayor Joy Belmonte's gargantuan efforts. No? Napakamalaki po ang inyong papel ginagampanan bilang leader, no? Bilang namumuno sa Quezon City, at you are the #1 influencer in this place, in the city in Quezon City, in your LGU. Kanya po ang mga tao ay talaga po they look up to you. Kanya maganda po na tama ang mga impormasyon na ating pong ibinibigay sa kanila. So babalik lang po tayo at bibilisan ko lang po dahil alam naman po ninyo ang ating COVID-19 response has too many, I'm not saying it has many, but too many moving parts. And that is why the success of the outcome of those moving parts relies heavily on the leadership. Key here is leadership. But remember, leadership does not rest only on the mayor's shoulders. No? Leadership rests on the collective effort of the city council, of everyone working in the local government unit of Quezon City. No? So there is no one unimportant role or position in the organization of your local government unit, so that you need to mind and you need to synergize between and among yourselves. No? What can be the best inputs that you can possibly contribute to the overall success of your pandemic response. Now, of course, the narrative has gradually changed towards a greater focus on vaccination. I think you and I, everybody here, understands that yung prevention, yung early detection through aggressive contact tracing, testing, aggressive isolation through Oplan Kalinga, treatment interventions of both the severe and critical cases, which is being coordinated very effectively and efficiently by our One Hospital Command treatment czar, Yusek Ben Vega, and then also our isolation and quarantine facilities, where I think Quezon City has manifested such great progress in terms of ramping up your capacities, no? And certainly we hope that Quezon City will be a model, an exemplar for all other LGUs to look up to and to clearly pattern their own response, no? After. So now that we're talking about the immunization plan, by and on itself, the immunization plan also has several moving parts, and you need an orchestrator here. So Mayor, you're the #1 orchestrator of these immunization efforts of the local government of Quezon City. Alam po naman natin yan. We have 7 stages of the national government immunization plan. First, of course, I'm sure that Secretary Galvez has already touched on this, but let me just very quickly enumerate to you so we have a better grasp, an overview of what the elements of our immunization plan are. No? And these elements, of course, include, #1, we have the napaka-importante, vaccine evaluation and selection. The overarching consideration in our effort to immunize our people is really to give them the safest, the most effective, cost-effective, as well, sustainable immunization program for all the citizens of this country. But let me just qualify, not just all citizens, but really eligible citizens of the country. Because kahit ano naman gawin natin, may mga iba ayaw magpabakuna, may mga iba anti-vaxxers, may mga iba napasok sa kulto na hindi naniniwala po sa bakuna. So, hayaan na po natin iyan. Pero napakamahalaga po dito na ang kumpiyansa, ang tiwala ng mamamayan ng Quezon City ay malakas. At naniniwala sila na ito pong bakunang ibibigay natin, kaya ito po galing sa mga iba't ibang bansa, galing po sa mga iba't ibang mga vaccine manufacturing companies, ay dadaan po sa napakamahigpit na proseso. A stringent evaluation regulatory process. No? Andiyan na po, respeto natin ang magagaling na bumubuo ng ating vaccines expert panel ng Department of Science and Technology, ang ating pong Single Joint Review Ethics Board ng ating FDA, na siya din naman ang susuri, ang ating Health Technology Assessment Council na nalikha sa ilalim po ng Universal Healthcare Law. Lahat po yan, ang hangarin ay iisa, makapagbigay ng tunay na ligtas, epektibo na mga bakuna. So, dapat wala po tayong duda. At Mayor, ako po nananawagan sa inyo and the entire collective leadership of Quezon City na let us, always tell our people that these vaccines are safe. No? Of course, there is no such a thing as a 100% safe vaccines because you and I know even measles vaccines, even polio vaccines, even the more traditional vaccines do not offer 100% protection. No? So also, we have to be careful. Well, we cannot be over-promising as if, okay to. We say, meron din na hindi ito 100%, pero binabantayan po natin yan. Kung magkaroon po ng mga tinatawag na adverse events following immunization, whether they are, mostly I am quite positive, are minor adverse or side effects, but even the more serious adverse events will be managed. The LGU, your local health system, has been oriented, and the people, your doctors, your nurses, have already been hopefully oriented as to recognizing this serious side or adverse events following immunization. No? So yan po, number one consideration. And the rest, of course, yung sinasabi natin na assessment and access and acquisition. Ayan na po, ang sipag po ng ating vaccine czar. Siya po ang nangunguna sa negosasyon with the different vaccine manufacturing companies, and I believe he has delivered so much already even at this very early point in terms of negotiating for signing of the non-disclosure agreements, signing of the term sheet agreement, the signing as well of which is the final phase, is the supply agreement. And the two of us have signed together with the Secretary of Finance, Sammy Dominguez. No? So dadaan po ito. Tama po si Pangulong Duterte na sinasabi niya, ito talaga, dadaan po ito sa masusing pag-aaral at talaga po sisiguraduhin na ang cost nito talaga properly studied and referred against international pricing benchmarks. No? So hindi po tayo pwedeng maloko pagdating po sa pricing ng ating po mga bakuna. And of course, yung mga mas mabigat na mga aspeto ng ating immunization plan, katulad yung mga procurement at saka yung mga financing, hindi ko na po pag-uusapan yan. Dahil andyan naman po si Secretary Dominguez na napakamahusay din at malinaw ang kanyang direksyon tinatahak para maging matagumpay ang ating pag-angkat ng mga iba't ibang mga bakuna. Andiyan na po yung budget, meron na po tayong budget dyan. If I'm not mistaken, about 82.5 billion overall budget prepared for this. And then of course, you go to the more important aspects, I would say at the operational level, would be your storage and shipment storage pagdating ng mga bakuna, saan ilalagay ito, kailangan meron tayong national hub, meron tayong warehouses, pupunta po sa mga regional hubs and warehouses, at pupunta ito all the way to the end point, which is the vaccination sites, no? Delivery or distribution to these vaccination sites. And it's a chain of supply, no? Readiness, end-to-end supply chain adequacy and readiness. So we need to prepare for that. And while we understand that end-to-end supply chain system, it is very important that underneath that is the sensitivity of these vaccines to varying temperature requirement. No? So we have one, which is Pfizer, that requires a negative 70 to negative 80 degrees centigrade storage facility, followed by Moderna, that requires a negative 20 degrees centigrade storage facility. And then you have the more, for the traditional vaccines, ito pong mga from positive 2 to positive 8 degrees centigrade. So, nagbabago-bago yan, ano? So, depende yan, no? Like ang Pfizer, ang kailangan niya 70 degrees centigrade for 6 months yan. Maiksi lang ang shelf life ng mga bakuna, mga 6 months lang. No? Kaya dito, speed and precision are key to the successful management and implementation of your immunization plan. No? So, ito pong mga cold storage facilities, this is very, very important. No? So, 30 days. Halimbawa, ang Pfizer, kailangan magbabago ka ng dry ice mo. You have to replace your dry ice every 5 days for 30 days ability to preserve the vaccine. And pagdating na doon sa actual vaccination site, meron kang 5 days lang na pwede mong i-store yung vaccines, and beyond that, book na. Panis na yung bakuna. So why am I saying this and underscoring this? Because we cannot have a take 2 or take 3 when we roll this thing out because of the sensitivity of certain vaccines. Eh, hindi naman lahat ng bakuna ginawa pare-pareho. Not all are made equal. So iba-iba po yan. Eh, malaking pondo. Pinag-usapan po natin dito, billion piso halaga. Kaya ako po nananawagan sa ating pong mga implementers na talagang we have to be very conscious about speed and precision. Not only because we're talking about the vaccines, no, but we're also talking about our people's aspiration to be given this protection against COVID-19. And the earlier, the quicker we can do this together, the better our protection will be for our people. No? So yan po ang mga gusto kong bigyan din. And the actual immunization implementation, I look forward to the local chief executives to really orchestrate this in the most deft, in the most effective and efficient way. And the national government is here to identify the gaps today. If there are, I know I will have to look at your plan and how you're going to implement. But always bear in mind that plans can be excellent on paper. But the proof of the proof of the pudding is in the eating. Okay? So you can have all these grand plans, no? But if your execution is sloppy and faulty, then that plan is useless. So that we need to really plan very, very well. At that stage pa lang, dapat malinaw na tayo. And then, bubutasan natin. Diba? Butasan natin. Huwag tayong mahihiya. Huwag tayong magiging sensitive o pikon na may nambubutas ng plano at sinasabi yung plano mo, kulang dito, kulang doon. Okay lang, huwag ka mapipikon. Kasi yung mga constructive criticisms na yun will continue to improve your plan. And the better the plan, the better the execution. But of course, the execution is also a different ball game. No? But what is important is essentially, if you have a good plan, you can execute better. Okay? You can implement better. And you must understand why you are doing all of this. You have to look at the big picture. Don't get lost in the trees, as they say. No? Yung strategic view or contextualization of your immunization plan. You know, it's for the people, and communication is important. By the way, I would like to stress that you need to have a sub-task group on demand generation and risk communication as well. And do not feel as if your efforts in ramping up your risk communication, your marketing thrusts, no, is limited to government. You have to look into the private sector. Private sector cannot run this in a silo. You need constant coordination with the private sector. So there is an alignment of communications, of messaging. Because the important thing here is people understand why we're doing this. No? It's for the protection. It is for the economic recovery, recovery of normalcy in the lives of our people. No? So all of these are really important as core of your communications strategy, your messaging. Ano po. So, marami na po akong nasabi, but bandang huli, ang ating pong layunin ngayong araw ay tignan yung inyo pong mga nailatag na plano at kung meron kayong simulation. Meron ba kayong simulation today na gagawin? Nagawa nyo na last week. So siguro, we can just show us what has been done. Natapos na po ba? Yung video. Sige po. So, muli, sa ngalan po ng IATF at kami po ay napag-utusan ni Pangulong Duterte bilang ating Pangulo at namumuno sa National Command Authority under which the IATF, the NTF operate. We would like to again thank the city government of Quezon City for your very warm reception. But suffice it to say for now that the objective of our meeting today is very clear, and that is to look at, assess your plan and your execution plan as well. So we will be here in full support of what you need to improve execution and therefore achieve the desired outcomes that you and I and the rest of the citizens of Quezon City expect. Kasi po talagang this is a major undertaking and historic because there has never been such a huge effort of this size in the history of our government. So di yung sinasabi ko, you are part of this history. And so are you, Mayor Joy Belmonte. You are a part of this history. There will probably never be something like this again in the near future, hopefully. But let's seize the opportunity. Carpe diem. Let's seize the moment. We're given this opportunity to serve our people in this pandemic. And we are not just passive citizens as this pandemic unfolds. We must contribute. We must deliberately achieve the successful outcomes that our people deserve. And so let's create this history and let us make city government of Quezon City really at the core of this historic event. On this note, I'd like to thank you and lahat po ng aking mga kapwa lingkod bayan, maraming salamat po sa inyo pong pakikinig sa aking mensahe. Salamat po.
Thank you very much. That's of course Secretary Duque. Okay, as a recap of the speakers, our panel of speakers who just gave their messages to us this morning, we began with Secretary Carlito Galvez Jr. and NTF Against COVID-19 Implementer and Vaccine Chair, followed by Honorable Carlo Nograles, Co-Chairperson, IATF on the Management of Emerging and Infectious Disease, and then ASEC Marcelo Morales, Department of Interior and Local Government. Of course, last but not the least, Ms. Secretary Francisco Duque III, IATF Chairperson, Department of Health. I am now ready to present to you the next part of the program that is, of course, giving you an update of a report on our local COVID-19 situation in Quezon City. May I now turn over the microphone to our Honorable Mayor, Josefina Belmonte.
Maraming salamat, Ma'am Teta.
Thank you.
Isang magandang umaga po sa ating lahat. Bago ko po ipagpatuloy ang ating pong maikling presentasyon patungkol sa current COVID situation ng ating pong lungsod, nais ko lamang pong magbigay pugay sa ating pong mga panauhing pandagalan na andito ngayon. At labis-labis po ang aking pasasalamat sa inyo na naglaan po kayo ng oras at panahon para dumalo po sa amin at magbigay po ng payo sa amin patungkol po sa kung paano pa natin pagagandahan ang ating pong COVID response. At ngayon po, papakita rin po kami ng plano namin with regards to the deployment of the vaccination plan. And we really look towards your guidance para mapagpaigting pa natin po ito. I just want to say, Secretary Galvez, I'd like to thank you with all of my heart. Alam po ninyo na kapag nangangamba po kami sa Quezon City, kayo po ang amin pong nilalapitan. Kahit ano pong tanong o ano pong concern, pag nilapit ko po sa inyo, lagi po ninyo akong sinasagot na huwag kang mag-alala, Mayora, hindi po kita pababayaan, hindi ko po kayo iiwanan sa Quezon City. At yung mga words of reassurance po ninyo, yun po ang nagbibigay lakas sa amin dito po sa amin pong team. So maraming salamat, sir. Alam kong very busy kayo, but you always have time for us. God bless you, sir, for that. And sa akin pong Kuya Carlo, kahit mas matanda po ako sa kanya, siya po ang big brother namin. At parang isang kuya, kapag meron po tayong nararamdaman, kunwari, naninikip ang dibdib natin sa stress sa ating pong trabaho dahil napakabigat. Tinetext ko po lagi si Cabsec Carlo. Alam natin yan. Kasi kumpare ko po siya, personal friend, and I always tell him how I feel if there's a problem, and he's always there to reassure me as well. So I'm so grateful for that, Carlo Cabsec, for always being there for us. And si Secretary Duque, big brother ko din po. Talaga naman po mas matanda po kayo sa akin. So big brother po talaga kayo. But I love also the fact na si Secretary Duque naman po, kahit sobrang busy, pag nakita niya na medyo may spike sa mga bilang po ng Quezon City, tatawag po yan sa akin. At napaka-gentle po niya, hindi po siya confrontational, pero lagi niya po sinasabi, Mayora, parang tumataas ang bilang. So I just have to tell him naman, sir, we know and everything is under control, and he says, I trust you, that you will do a good job. And I appreciate, sir, that you have that time to call us and remind us of our duties. At gusto ko rin pong idagdag ang aking pasasalamat kahit wala po siya dito, si Secretary Vince Dizon, na isa rin po sa mga haligi ng COVID response team natin, who is always there for Quezon City. Hindi po kami pinabayaan kahit kailanman, hindi kami iniwanan. And I would like to greet, of course, si Asek Morales, who is representing Secretary Anyo. Again, one of the bastions of support that we have here in Quezon City. Binabati ko rin si Ma'am Dr. Paz. Thank you po, ha. Alam nyo, I love Dr. Paz because when we had the UK variant here, in Quezon City, she rushed to the office within minutes after finding out about it. At talagang kinausap kami, ginabayan kami hanggang sa nalutas po natin ang problemang yan. So thank you po, Dr. Paz. Asek Punsalan, thank you also for always being there for us. And to all of the staff of the DOH and the MPF and the IATF, thank you so much. Very fast lang po itong presentation ko. It's just an overview in numbers of what's happening here in Quezon City at the moment. May I have the first slide po. So this is COVID-19 in QC in numbers. At the moment, we have, as of January 26, we have 1,184 active cases, that's 4%. 28,023 recoveries, that's 93%. 802 deaths, very unfortunate and sad, but that represents 3%. No, but I wish that was much lower. And as of the 26th, our average cases per day, 95 cases per day. Umaabot po yun ng 400 cases nung kasagsagan po ng pandemya nung July, August. No? And so this is actually quite a good number already. Next po. So ang positivity rate po sa lungsod Quezon is 4%. Ang QC reproduction rate po is 1.04%. It is slightly less, but I think it's statistically the same as NCR, 1.08 po sa NCR. The source of our data po is Octa Research. Octa Research po is a partner of the Quezon City government. We have a memorandum of agreement with them wherein weekly ay ina-analyze po nila yung raw data namin galing po sa CESU. So ito po ay ang latest na report nila po sa amin. Next po. So ito po, kung mapansin po ninyo, nung dumating po ang Disyembre, pumalo po ang Disyembre, ang taas po ng bilang natin. So it is true na tumaas po ang numbers because of the Christmas season. And then as you notice, there is a dip. But that is an artificial dip brought about by the lack of testing or the magsara po kasi yung mga labs for the holiday seasons at nabawasan po ang mga testers. So that's actually an artificial dip. Ito po yung tunay. Nakikita natin na when January started, nag-stabilize ulit ang operations ng Lungsod Quezon. And we have now a stable line. And more or less, our positivity rate has fluctuated from 0.99 to 1.04 in the last 3 weeks. Na po, sir. So next po. So again, total PCR tests conducted, 136,710. Community-based testing sites, we still have 6. Mobile testing units that go into our remote areas, 2 po. We have 1 QC molecular lab, and we test an average of 2,500 persons a day, both in the private sector at sa SESU po natin. Medyo mataas po yan tingin ko compared to other LGUs. No? And I think again, Secretary Dicon, who has always guided us towards our testing. Next po. So sa cheat naman po, we have 163 city hospital COVID-19 beds available. No, and then 2,000 plus quarantine beds. These are in the city facilities as well as in our different barangays. No? So ito po yung aming occupancy rate. Very nice po ang numbers natin. 32% sa QCGH. Sa Rosario Maclang Bautista, 34%. Yung NDH, 72%, slightly higher, but it's because there are very few COVID beds in the NDH. At sa Hope quarantine facilities natin, we only have an 18% occupancy rate at the moment. No? Next po. So trace, we have 500 contact tracers hired by the city, 300 po sa barangay, and 30 personnel from the Philippine National Police. I just want to thank the DILG because when you assign 2,000 contact tracers po to us, sayang lang po nag-expire po yung kanilang kontrata. Umabot po kami ng 1:30 per positive case. Kaya lang po, nung natapos na po yung kontrata, nawala na po yung contact tracers from the DILG, ito na po yung aming contact tracing workforce. Not so bad, still 1:15. I have written Secretary Anyo, and they have promised to give us another 500 contact tracers. So thank you very much for that. Next po. So we have had 78 special concern lockdown areas. Alam naman po ninyo, ito po yung specialty namin, mag-lockdown po talaga ng mga skinita, ng mga compound, ng mga kalsada. So ito lang po yung numbers. We have conducted RPT test na 7,118 sa lahat po ng lockdown areas. In other words, we test everyone, we lock down. That's rapid test pala, yung 7,118. Tapos yung RT-PCR, 9,596. Food packs distributed, of course, we have to feed all of the families that we lock down. Medyo magastos po, but I feel it is our duty to make sure na hindi talaga sila lalabas. And the total number of families we've locked down, 11,546. And confirmed cases sa loob ng lockdown areas po namin na yan, 1,256 confirmed cases po. So that means that the lockdown is actually effective. We are finding many cases in our lockdown areas, which is indicative of community transmission. Next po. So at present, nung tumalo na po yung Enero, ito po, we had no lockdown areas for a very long time. No? Since October, I think, wala. Bigla na lang nung pumalo ang Enero, tingin ko may konting epekto yung festivities ng Kapaskuhan. We have had 7 lockdown areas. Pero dahil nga mabilis na po kami mag-lockdown ngayon, index cases, kahit konti lang po yung index cases we lock down, we test right away. So, ito lang yung mga confirmed cases so far in these 7 lockdown areas. We ensure that they stay locked down for the 14-day duration that is advised to us by the DOH. No? And ang magandang balita, once we lift the lockdowns, ay healthy ulit yung community. No? That means that I think that this is really an effective way of addressing COVID in our city. Next po. So ito lang, I just want to tell you very quickly what happened to our UK variant, ma'am. So actually, nung nag-test siya ng positive sa airport, nadala po siya sa Hope facility mo namin agad. Never po siya napunta sa komunidad. Never step foot in community, and yet we conducted contact tracing up to the 3rd generation. No? So lahat po yan, out of 214 close contacts, 3 lang po yung nag-positive. Si girlfriend po, who came from Dubai with him but tested negative on the onset, we tested her again. She turned out positive, but not for the COVID-19 variant. The mother tested positive, but I think hindi nahawa sa kanya, talagang sa community in a different, independent, unrelated occasion niya nakuha yon. Tapos may midwife po sa aming facility na nag-positive, pero ang interpretation po doon, she just had COVID, so remnants po ito ng COVID na kagagaling lang niya. So hindi po yun contagious and has nothing to do with the UK variant. So ano ang gusto kong sabihin dito? Wala pong UK variant dito po sa Quezon City. We are clear of the UK variant. Next po. But as a safety precaution, ang ginawa po namin ay pinuntahan na po namin ang 27 hotels na Quezon City na ginagamit as mandatory quarantine facilities and stringent quarantine facilities. Yung stringent quarantine facilities po, ito po yung mga hotel kung saan ang mga returning Filipinos na nagagaling sa mga bansa na may mga variant, doon po sila in-quarantine. We have assigned additional security personnel from the QCPD, and we also assigned additional security personnel from the barangay and from the city to make sure na yung mga nasa loob dyan stay quarantined at hindi po sila lumabas. So yan po yung current situation ng COVID-19 sa ating pong lungsod. Now I would like to pass the microphone to my colleague, Joseph Wico, who is the chairman of the ano ba yung task force natin? Vax to Normal. Vax to Normal po ang pangalan ng task force ng Quezon City, and Joseph will explain now our vaccination program. Thank you.
Hello. Thank you, Mayor. Good morning to everyone. I'll just get straight. Okay, this is the Quezon City COVID-19 vaccine plan. We started the vaccine plan when the mayor issued executive order back in December 3 for the creation of the Task Force Vax to Normal Quezon City Vaccine Plan. Given the size of the city, the mayor thought that we should put a permanent team to address the big issue on rollout of vaccination, which includes multiple times of planning and consulting with DOH. And with that, next slide, we created a composite team separated into 4 components. First is a supply chain management, immunization, data management, and communications. All four sectors are equally important. And given that this is a cold chain process, a delivery process, there should not be one chain that could be considered as the weakest link. All have to be strong to support one another. Later on, I will explain the components of each sector. So next slide, please. So from the 4 sectors that we mentioned earlier, we divided the plan into 3 portions: pre-vaccination, vaccination, and post-vaccination. Majority of the task is going on now because planning is very important prior to execution. So with the pre-vaccination, we have the listing down of all the priority sectors, our implementation integration of our QCID system, our communications campaign, human resource, getting all the inoculators and all the people to man all our vaccination sites, warehousing and supply chain, which is very important, delivery network and logistics, which goes in tandem with our warehousing and supply stockpile, identification of all vaccine sites, and from the vaccination part, it's an implementation of the proper vaccination flow, emergency response, and of course, our post-vaccination plan to monitor all those people that have been inoculated. Next, please. So in our priority listing, we have a total of 1,046,027 individuals. The priority listing we are following, what the DOH has mandated us to prioritize. Next. So we have our Quezon City healthcare workers. These are 3,200 3,292, composed of people from our healthcare workers coming from our LGU hospitals and also from the Department of Health in our LGU. Next. Our BIRDS, our Barangay Health Emergency Response Teams. These are 1,410. Next. And then our private health workers in our private hospitals, it's around 18,325. Our senior citizens, both indigent. After we prioritize the indigent senior citizens, we have to prioritize the remaining senior citizens. So approximately that's around 300,000. Next. Our indigent persons, we have a database of indigent families. We took away already here the 15 years and below, so approximately that is 703,000 indigent persons. Next. Our uniformed personnel located in Quezon City Hall, which is divided amongst our traffic enforcers, security guards, PNP, social workers, and other uniformed personnel such as those in our Bureau of Jail Management, Bureau of Fire, and so on that are here in Quezon City. Next. And of course, our adult PWDs that accumulate to about 20 million, approximately 20,000 people. So current human resource that we can allocate to our inoculation sites from the health department are around 315. Actually, Sec Duque, we can increase that. But if we increase that, we might end up leaving some of our health centers unattended. So we have to balance that out. So definitely what we're trying to do here is coordinate with our private hospitals, other medical associations, if they can augment and send us more people to man all our 24 sites. Now, the capacity of the warehouse that we're talking to now is Willig Pharma, which you all know is around 3.6 million doses ang kaya nilang store. With all the degrees necessary, Willig has it. From -70, -20, 2 to 8. That's the reason why we're talking to them and why we want to partner with them. Because any type of vaccine that the national government gives us, Quezon City will be ready because we have Zwillig as a partner. Delivery network and logistics, that is also in partnership with Zwillig because they have the capacity, they have the know-how, they have the knowledge. And since Quezon City is the largest market in the entire country, Zwillig is the person that we have to talk to. Next. Now, this is how we would register since I've already presented the pre-registration. This is how we would register. Thanks to our City Administrator, Mike Alimurong, we already rolled out our QCID system. With the QCID system, we will integrate this with the EasyVac system of Zwillig Pharma. So from our QCID system, you register, and then there's a question there that would ask, are you willing to be vaccinated? The minute that you say yes, it will. There will be a link that will coordinate you directly to the EasyVac system and all the medical questions needed to certify you if you can or cannot be vaccinated will be taken care of the EasyVac system of Zwillig Pharma. Okay, next. Quezon City, with those that register for our QCID system, we did an informal survey. The question is, would you willing to be vaccinated against COVID-19? Out of the 46,000 people that registered to be part of our QCID system, 26,420 said yes. That's around 56%. I heard you say Duque na tap, no? Okay. And then our undecided is around 15,000. That's about 33%. And the no is around 9.7%. So now, with this data, Quezon City is striving very hard to focus on our comms plan. Given that we have about 15% undecided, if you total that 56 and the 33, that's already 80%. That people that are willing to be vaccinated here in Quezon City. So with that, Quezon City launched next our QC Protect Todo sa Bakunang Sigurado. Why do we call it Protect Todo? Because we are protecting ourselves now. We have our masks, we have our face shields, we are socially distant, we are washing our hands, and once we get inoculated, talagang protektodo ka na. Diba? It's a full complement already sa bakunang sigurado. Why are we emphasizing that? Because we want to bridge that, we want to send a message to our people that one, the national government and local government will not accept any vaccines that are not that will not go through any stringent regulatory authority, and that we can assure all our citizens. That's why kailangan natin ng bakunang sigurado. This is our vaccine confidence campaign. Next. So, what is the strategy? Social media information drive, webinar series, engagement with all our barangay leaders, because they are our force multipliers to informing our communities about the safety and efficacy of all vaccines, because we need them to be our partners. And also public relations, we have an existing partnership now with AKAP Guro, Unilab, and also collaterals, flyers, and so on. Okay, next. Last week, we launched on our Facebook page, it's called Sa Totoo Lang, meaning we will only rely on the truth. It's an information campaign, a webinar series, open to the public. They can chime in and ask questions, and we invite experts to be part of this webinar series. Last week, we had Dr. Gloriani, a member of the expert panel for the vaccines, and there were about 36,400 viewers who watched her listen and explain how vaccine works. And up to now, it's still growing. You can watch it anytime. Just go on to our QC Facebook page. And later in the day, if you are free, we would like to invite you at 2 o'clock in the afternoon. USEC Eric Domingo will be our guest to talk about the processes on approving vaccines. This is what we want to do for our Quezon City citizens, to give them the right information. Hindi tayo naniniwala sa mga vaccine oppositors or what, but we want to give them informed choices so that our citizens can know, can be guided if they should be vaccinated or not. So I hope everybody can watch 2 o'clock po. Ipo-plug po namin yan sa inyo. Thank you very much. Okay. And aside from that, we will be coming out with flyers, posters, flyers with FAQs to be distributed in different areas. And once you are vaccinated, the Quezon City government will be giving out pins or stickers that says, QC protektodo na ako. Para at least malaman natin na yung mga tao na yan nabakunahan na. Okay, next please. Now is our vaccine rollout, and this is in partnership with Swilik Pharma. Next. With our vaccine rollout, Quezon City has already identified 24 sites spread out in all 6 districts. So with the 24 sites, the mayor and si Perry, who heads our cold chain, also had talks with the diocese of Cubao and Novaliches. And they already said that all their parishes are willing to be inoculation sites as well. So that's also a good way as a force multiplier for us to set up more sites once we have the available manpower also. Okay, next. Now this is the playbook that the entire process from procurement of the vaccine to the entry to the Philippines, receiving and storage to be brought to the central warehouse of Swilig Pharma, transportation to be delivered by all the trucks, the cooling trucks coming from freezer trucks, coming from Swilig Pharma. Then the ordering and implementation, there is a platform that we will be using, and post surveillance where we will also have a platform for that. Okay, next. Now, this is why we are using Swilig Pharma, because they have a medical grade warehouse. As I said earlier, all the necessary temperatures are already here. With whatever vaccine that we procure or the national government gives us, they are ready to store it and they have all the complements for us to roll out the project or the vaccines. Next. Now, what is important, Sec, is the reverse logistics. So we are coordinating also with DOH and also with AstraZeneca, and I think Zuilig Pharma is also part of this. This is to ensure that no syringes will be used again, that they will be thrown away properly. So that's one of the things that we have to focus on. And then the delivery device that they would be using, the Easy Cooler, wherein the vaccines will be safely stored during transport, that the temperature will not be compromised. It's very important. And also the system that we will use to monitor the rollout of the vaccine, the number of people that have been vaccinated, the number of sectors that have to be prioritized, and how many have been vaccinated in an area, in a barangay, in a district. Okay, next. Now this is the process flow. This is when we simulated last Monday, correct? Last Monday in Emilio Aguinaldo Elementary School, that's in Cubao. So we start off with the registration that would take around 3 minutes, counseling as part of the registration, another 3 minutes, doctor's assessment, 5 minutes, vaccination, around 3 minutes, and then conservatively observation for about 30 minutes. So as you can see, there's a step-by-step process on the lower right side from registration all the way down to the exit. So the target set is around 45 minutes. That is our target. That includes also the monitoring of 30 minutes. So hopefully we can do that. As you said, planning is only as good as how it's executed. So we're crossing our fingers and our toes that we can do this properly. Okay, next. So per site, we've dedicated 2 doctors, 3 encoders, 2 counselors, 3 screeners, 5 inoculators, 2 post-monitoring, 6 marshals, 2 guards, and 2 ambulances. So that's a total of 27 personnel per vaccine site. For 24 sites, we need around 648 people. Okay, next. These are the equipment and supplies needed per vaccine site. I won't go through them one by one, but mostly we need laptops, portalets, electric fans, iwata, tables, chairs, LED TVs, CCTVs, and emergency ambulances. Next. So, our plan is, in the next 30 days in a month, we're open 8 hours a day. Per inoculator, they should vaccinate 70 people. So since we have 5 inoculators per vaccine site, they can inoculate around 350 people. So per inoculation site per month, that's around 10,050. So at 24 sites total in a month, we can inoculate 252,000 people. So at 250,000 people, at 6.3 to 8 months, we can inoculate around 1.6 million people in 6 to 8 months. Ideally, that is the target. We will do our very best, but definitely we can only do this once the vaccine arrives. So we will do it little by little as they roll out, and we'll make sure that Quezon City will be ready to take on the challenge. Next. For our emergency response plan, we have definitely our medical doctors will be present in all sites. Our births, we will have 1 ambulance for the births and 1 ambulance for the DIRMO to be present. The establishment of the referral system, this is when adverse events happens. They should, for every inoculation site, a hospital has been dedicated to receive all of those that might develop any adverse events. And we will make sure that each site will have an EpiPen available just in case for emergencies. Okay, next. So this is, well, I'm not sure if you can see it clearly, no? Basically, this is what I mentioned earlier. We will have a dedicated dashboard for Quezon City to monitor the release of the vaccines as long as it's arrived on time, the lot number, and so on, that the person is receiving the right vaccine, and also to monitor the patient for their second shot. Nandiyan din po siya kung anong barangay, anong kalye, kung anong sektor siya, etc. etc. Nandiyan po siya. And on the right side naman, nandito po yung text message na makukuha ng tao reminding them of the confirmation of their vaccine on their second shot and who to contact for adverse events. Everything will be there via text and email. And for those that don't have phones, we will be issuing phones or emails. Once they register, we will be issuing them a hard copy with a QR code. And then for follow-up, we will be coordinating with our barangays and BRICS to follow up all those people that do not have access to a cell phone or to an internet connection. Okay, next. For a post-vaccine, we will dedicate a team in our hotline 122 to answer all questions, and all our telemed operations and all our city healthcare facilities will be operational so that people who have been vaccinated or have questions with regarding to vaccines can be addressed. Okay, next. That's about it. I hope we were able to clarify things. And siguro, there's a video that we would like to present also with regards to our simulation that we did last Monday. Thank you very much.
Mahigpit na sinusunod ang international standard sa pag-imbak ng bakuna sa planta. Sinanay ang mga empleyado na tiyaking nakaimbak ito sa tamang temperatura na 2 to 8 degrees Celsius. Kasya sa planta ang 6,000 paleta or 50 million doses. May ultra-low freezer din ang planta na kayang mag-imbak ng 6.5 million doses hanggang sa lamig na negative 80 degrees. Sinisiguro rin ang continuous power supply sa pasilidad. Bago ilabas sa planta, inilalagay ang mga bakuna sa easy cooler transport box upang mapanatili ang tamang temperatura sa loob ng 96 hours. Sineselyohan nito ng maayos, may dry ice at ibinabiyahe sa mga sasakyang kontrolado ang temperatura. Bago pa dumating ang bakuna sa vaccination center, umuusad na ang proseso ng pagpapalista ng mga babakunahan. Ang mga babakunahan ay dapat nagrehistro na sa Q-Citizen ID. Ang QCID system ay nakakonekta sa application na EasyVax na siyang gagamitin sa proseso ng pagbabakuna. Step 1. Dadaan ang babakunahan sa screening upang kumpirmahin kung maaari siyang bakunahan o hindi. Kailangang sagutin ang mga katanungang itinakda ng International Center for Disease Control and Prevention. Kapag nakumpirma na, makakatanggap ang babakunahan ng health password na naglalaman ng kanyang impormasyon at QR code na magsisilbing digital ID ng pasyente. Step 2. Mula sa waiting area, ang mga babakunahan ay papapuntahin sa registration area kung saan ipapakita ng pasyente ang kanilang QR code at valid ID. Step 3. Matapos ang pagrerehistro, ang babakunahan ay dadalhin sa counseling area kung saan ipapaliwanag ang benepisyong hatid ng pagpapabakuna. Step 4. Sa assessment area naman, aalamin ng mga doktor kung karapat-dapat magpatuloy ang pasyente sa pagpapabakuna o hindi. Step 5. Kapag aprobado ng doktor, ang babakunahan ay ihahatid sa vaccination area kung saan gagawin ang pagpapabakuna. Step 6. Matapos ang pagpapabakuna, pupunta ang pasyente sa post-vaccination observation area. Dito, oobserbahan ang pasyente mula 30 minuto hanggang 1 oras para matiyak kung may mararamdaman siyang anumang side effects. Kung wala, maaari na siyang pauwiin. Kung sakaling may side effects siyang maramdaman, may nakaabang na ambulansya na pwedeng maghatid sa kanya sa pinakamalapit na ospital.
Mayor, before we move forward, I just want to acknowledge the Backs to Normal team. No? First, si Dr. Arias and Doc Rolly. Can you please stand up? They're the ones that are taking care of our immunization cluster. Thank you so much. Dr. Arias, our head of our city health. Si Ali Medalla and si Bert sa comms. Thank you. Paul and si Mike for the data management system. Thank you, and of course, our mayor. Thank you for your guidance. Thank you very much.
Thank you so much.